I am Dr. Kalyan Kumar Gangopadhyay. I am a consultant in endocrinology, Peerless Hospital, Kolkata. Hypoglycemia. Today I am going to talk a little bit about hypoglycemia and an interesting audit which we have done in our hospital, Peerless Hospital, Kolkata. Hypoglycemia, as the name suggests, that means low blood sugar. What exactly is low blood sugar? So when your blood sugar drops below 70, that is called low blood sugar. When it drops below 70, your body tries to fight it. Your body tries to get it back to above 70. In trying to do so, you will get a lot of symptoms because the body is fighting it. What are the symptoms? You will get sweating, dizziness, shakiness, feeling unwell, your hands will begin to tremble. All these are symptoms of hypoglycemia. Now, patients with diabetes are on tablets or insulin to lower their blood sugar, but many a times it goes below what we intend it to be. So therefore, patients with diabetes must know what hypoglycemia is, and also importantly, relatives of the patients, their healthcare providers, everybody needs to know about this. So I have told you about the symptoms of hypoglycemia. Now I will tell you what to do if you have the symptoms, or what would you do if your friend or your relative has got this symptom in front of you. The answer is pretty simple. You need to give 15 grams of glucose. Now glucose is not always available. What is available is sugar. And what is 15 grams of sugar? You know, 1 teaspoon is 5 grams. You give 3 teaspoons of sugar. If there are no teaspoon, you have sugar sachets. You know, they are easily available across all the cafes in the city. You can buy it from the shops. They are available in small packets, and each packet is of 5 grams. So it's very, very convenient to carry it in your purse, in your bag, in anywhere on your body, in your pocket. So whenever you have these symptoms, just tear off the sachet and take it, 15 grams in one go. So after you have taken it, it is advisable that you also have a small snack like a fruit or a couple of biscuits, for example. You should check the blood sugar again after 15 minutes. If the sugar levels now go up, so to be on the safe side, if it is more than 90, we say fine, now your hypoglycemia has been corrected. But if after 15 minutes, if your blood sugar is still less than 70, you should repeat all these steps. Now, this protocol is pretty clear and is internationally published everywhere. If, however, the patient is drowsy or unconscious, then it is dangerous to give anything by mouth. In such a case, you do not have any option but to bring the patient to the hospital straight away, because he or she needs glucose to be given through the veins, because you are unable to give it by mouth. If you give it by mouth, it will go straight to the lungs and it will cause further injury. Now, the protocol for managing the hypoglycemia, as I said, is very clear. We wanted to do an audit to see what is happening to the patients who develop hypoglycemia while they are inside the hospital. I was surprised to see that throughout the literature, there is hardly any data of any hospital in India doing an audit of the hypoglycemia management. So we are perhaps one of the first to do this in the country. What we found from the hypoglycemia audit is that a number of patients in whom there was hypoglycemia, the protocol which is there and published is not quite followed as we want it to be. There was room for improvement. We then did an interview of all the nursing staff and the healthcare providers. What we found were the gaps. What were the gaps? Gaps in knowledge, gaps in knowing the exact protocol, and gaps in getting the sugar sachets or the dextrose injections in time. So this was very quickly identified by a questionnaire. What we then did is we developed a hypo box. A hypo box that's the term given to the box. It has got the protocol. I just told you the protocol, what to do if the patient is conscious and what to do if the patient is not conscious. That is pasted on the hypo box. So any healthcare provider can have a look at the protocol and do the needful. And when you open the box, it has got the sugar sachets in it. It has got the dextrose infusion in it, the infusion giving set in it, all the equipments needed to give the dextrose very quickly to the patient. So if further hypoglycemia occurs to any patient in any of the wards, the nursing staff, the doctors have easy access to the protocol and easy access to all the equipments needed. So we thought that why shouldn't this be there in every home of a patient with diabetes and their relatives? So I would suggest that you keep a box, you label it as hypo box, you keep the sugar sachets, you also keep the glucometer machine there as well, you keep a dextrose packet, you keep a 5 gram, the spoon which you get with the dextrose packet there. And on the top, you just paste what I have said, what to do in case of hypoglycemia. You just keep it in a corner which is easily visible to all your relatives and friends. So, if ever anybody has got a hypoglycemic episode and is feeling unwell, they know where to go and what to do and what to give, because all of these things are there in the box ready-made for them to administer. I'm sure the hypo box will improve the management of hypoglycemia tremendously across the wards in our Peerless hospital, and we want to re-audit it to see the impact. But I feel that if every household in patients who have diabetes also have this box, then you can at least be rest assured that in the case of hypoglycemia, you know what to do, where to go, what to see, and how to treat the patient with hypoglycemia. Because if a patient with hypoglycemia is treated early, then you can prevent hospitalization of the patient for hypoglycemia. Also important to remember that if you get hypoglycemic episodes, that means your sugar levels have been low, your medications need adjusting, so you should talk to your diabetes doctor that you have had this hypoglycemic episode so that he or she can direct changes to your management. I hope this was useful to you. Thank you and goodbye.